Hello, this is Jake MD, and today we're going to talk about something that is a common misconception that even a lot of anesthesia providers tell people before they have surgery to help relieve some anxiety and make people feel a little bit more at ease before they go back to have surgery. And that is comparing general anesthesia with sleep. And we're going to do a thought experiment to try to show why general anesthesia is not sleep, and then talk about exactly what it is if it isn't sleep. So I want to have you picture going to sleep at night in your house, and someone broke in, didn't hear them, and you're sleeping away, and they take a knife and try to stab you. And if someone stabs you when you're sleeping, I imagine that a few things would happen. One is you'd wake up, because people generally wake up if they even hear noise, yet alone if they felt something like a knife hit them. Two, you're probably going to feel some pain, and that would be obvious if someone stabs you. Three, I'm guessing you're going to move, since you're going to either try to run or fight off the person who's attacking you. Obviously, a normal response. You're also probably going to remember this event happening, most likely an event that you'll never forget for the rest of your life. And those are the main qualities that I would expect you to have in a situation like that. Now, let's take surgery, for example. Also, surgeon cuts you with a knife, trying to be helpful, not necessarily trying to hurt you. But without you being under general anesthesia, and if you're just sleeping, all those same things would apply. And there's no way surgery could be done if you were just asleep. So, with all that in mind, well, what is general anesthesia? And if we want to be specific about it, is actually reversible, because you can go under and then wake back up after, or regain consciousness would be a more appropriate term. And it is medically induced, since an anesthesia provider is giving you the medication that is causing you to lose consciousness and then wake back up. And then the state that you're in, you don't have memory, don't feel pain, you don't really move. Granted, depending on your depth of anesthesia, you could, and different drugs are used to stop that from happening. And then other things happen that under general anesthesia that you may or may not realize. A breathing tube can be placed to help support your breathing, because you have more difficulty either breathing on your own or breathing at all under general anesthesia, depending on what medications are used. And your blood pressure often needs to be supported, and those are also things that don't happen under normal sleep. So my definition of like what general anesthesia should be classified as, or what a medical definition would be, it would be a reversible and medically induced coma, is pretty much as good as any way to describe it. And that just means that you really do not respond or interact with your environment in any way when you're in that state. And that's a wonderful thing for surgery, since it's not something that you generally want to remember. You wouldn't want to feel it, since it would be painful to have someone operating on you. You definitely don't want to have memory of that, and moving would make the procedure extremely difficult. So all of those reasons make it so why general anesthesia is not sleep. So why do anesthesia providers and other people call it sleep? And mostly that comes down to people who are having surgery are generally pretty anxious, and that's just because of the circumstances that you're under. Surgery is a stressful time. People don't have it every day, so it's once or hopefully very few times in a lifetime event. So it is also something that you don't really know what happens since you're not conscious during that time. And an anesthesia provider tries to put you at ease either using medication or by reassurance from meeting and talking with you. And part of that reassurance can be equating it with something that you have happen in a normal everyday life. And something that people do most normally that equates closest to what anesthesia or general anesthesia is would be sleep. And because of the function of that, that's kind of why it evolved and why it's so commonly used. I personally even compare general anesthesia with sleep for patients if I see that they're nervous or have questions about what's going to happen. And that's just to help build a relationship and make them at ease. It's a white lie, but it's something that people can understand. If you have any questions or want to know anything more about general anesthesia, feel free to message me or comment. Otherwise, have a good day.